I'm also.
Good morning. Welcome back to 1160 AM KBDT News Talk Sports. We're JP, Kathy, and the crew. We come to you live Monday through Friday from 7 a.m. to 9 a.m. Don't miss Wayne Allen Root, raw and unfiltered, this afternoon from 5 until 8 p.m. only on 1160 AM KBDT News Talk Sports. And, you know, it is 8:34 a.m. It means that it is time for the mental health moment here on JP, Kathy, and the crew. I am very excited to welcome into studio Steve Dunn and Patty Giolet from the Morgan Foundation and Something for Kelly Foundation. Good morning to both of you.
Good morning, John.
Good morning, John. It's good to be here.
So the two of you have brought in a fabulous guest. Introduce your guest, and then let's jump right into the topic, which is extremely germane as we get closer to October.
Absolutely. When you think of mental health and the mental health community here in North Texas, there's one name who immediately comes to mind. This gentleman seems to know everybody in the industry. He's so incredibly well respected. He has saved a lot of lives in his time, and we're so honored today to welcome Phil Van Gilder. Phil?
Hey, good morning. Thank you. Thanks for a nice introduction.
Well, and Phil, right now you're doing some consulting for the Eating Disorder Solutions and the Greenhouse in Arlington. Is that correct?
That's correct, John.
Talk to us about your passion and what are we getting ready to deal with coming up here in October? What do we have?
It's Mental Health Month. It's Recovery Month.
Phil, also, I know that you have quite an extensive background in suicide prevention and counseling as well. With it being Suicide Prevention Month, I wonder if you could go into that work a little bit and just tell us a bit more about what you do along those lines.
I think probably the most important thing I do is listen. I listen to people talk about suicide and things they could have done or should have done. And the most important thing we can do is listen. And I'll hear people say things like, I didn't see this, or I didn't recognize those things. That's not something you can see or recognize. It's something you listen for. And you constantly listen, and you listen well, thoroughly, and completely. And then you're open about it.
And give us an example, like a for example of that, because I'm trying to wrap my head around what that looks like, what listening looks like, what that sounds like. So how would you describe that? What's an example of a time where you've truly listened and you've heard a red flag?
I received a call a few years ago from an individual who wanted to thank me for all the help and all the support I'd given him. And he said he hoped to see me again someday.
Oh.
Right away, as soon as I hung up, I made a call, a wellness check to the police, the local police department. It turns out that he was able to harm himself, but he recovered from that. A passerby caught him, but then later, several weeks later, he was successful.
Mm.
Now, Phil, we also talked yesterday about a recent event that you were involved with, a person who came to you for help that unfortunately was successful in this last attempt. He left some kids behind as well, and I know you had a chance to talk with him some without breaking any type of confidentiality. Can you tell us what you were told or learned from that so people can perhaps learn a little bit more?
Yeah, his situation was such that economically the family was compromised, and he felt like he was a drag on the family, and he felt that if he were to take his life, that would solve the family fortunes.
Mm.
He unfortunately didn't check with the family to see if they were willing to make that exchange. And that's the one I was talking about earlier. He ultimately was successful, and he got away, and he found the means to take care of the event that he wanted to take care of.
And that's so heartbreaking.
It really is. Phil, we also know that suicide, traumatic brain injury, PTSD is very big in our returning vets. And we know that you have military background. We know you have a special ring on your finger today. Could you go into what that ring means? And what are some of the things that you're involved in to do suicide prevention for our returning vets?
Well, the ring is 22 Kill. It's a group out of Fort Worth. They have a facility in Dallas. It was started by Tempa Sherrill, who's a therapist in Fort Worth. Her husband is a veteran. He was also a first responder. As a therapist, she started a campaign and then a practice that ultimately became part of 22 Kill. 22 Kill is for the 22 veterans that take their lives each day, men and women. So one of the things we can do is be aware of it, ask questions. I mean, those are the things. Whenever I see someone, I try to thank them for the service, and it doesn't matter if it's a veteran or first responder.
Absolutely.
The next thing out of my mouth is how are you doing? And listen.
Are there certain, as you talk to vets in particular, are there any unique signs that they give, let's say, that a person who is not served does not?
I don't think so. If you're alone and you're depressed, it doesn't matter if you're a veteran or a regular person on the street.
And age doesn't matter, economic background doesn't matter, religion doesn't matter, color doesn't matter, race doesn't matter. If you're depressed, you're depressed.
That's exactly it. And that's why it's things you can't see it. You have to listen, and it'll come out.
Now, Phil, I know as well there's been some debate about how broad, how sufficient is the mental health industry here in North Texas. I wonder if you could go into what you know about some of the services and programs that are available for those who are suffering with mental health issues.
Well, that's a wonderful question. So we have a very vibrant mental health community here. We have wonderful therapists, wonderful facilities to treat both mental illness, substance abuse, depression, anxiety is a big thing. We just hosted an anxiety conference last Saturday. We had 7 therapists and a psychiatrist all gave of their time to talk about anxiety. We do that annually. That was through Winning the Fight. We also have a wonderful resource in town, the Grant Halibert Foundation, and they have an unused line that people don't use. But there's a website called Here for Texas, where if you have any sort of challenges, you can go to herefortexas.com. You can key in what the challenge is, and it'll give you resources in your community. And starting last January, they upped it. They created a very intimate navigation line. You can call a number, 972-525-8181, Monday through Friday, and they have people for free.
If you'll give that number again.
Yes, it's 972-525-8181, and they have trained people that will take your call and help guide you with mental health issues.
Now, Phil, we know, unfortunately, that there's still quite a bit of stigma surrounding mental health issues. In many ways, it's still in the closet, shall we say. Have you done any research at all into the average amount of time that a person first recognizes or is diagnosed, let's say, with a mental health issue, and the time they actually start to seek help for that?
All right, so a typical physical issue is 3 days. You have an injury, you'll get to the hospital within 3 days or see a physician.
Right.
Mental health issues typically are about 4 years. unless you have depression.
That's staggering.
Unless you have depression, and then it's 7 years. Why? Because you think you're going to work your way out of that depression. And I'm certainly not going to tell anybody. I'm just going to fix it myself. I'm just not going to be depressed. It doesn't work that way. And I'm alone, and I'm afraid to tell you, because if I tell you I'm depressed, you'll think I'm crazy.
So for mental health issues, the average is 4 years.
7 with
but
depression.
for depression, it's 7.
It's 7.
Well, and and this is something, and I know Steve and Patty have heard me use this analogy over and over and over, and I even talked about it at the beginning of the show. If you have somebody who's got diabetes, you don't just say, "Hey, tell your kidney to suck it up and produce more insulin." I mean, so I don't understand, and that's the reason we're so excited about this mental health moment and having people like yourself on our show, because maybe we can start to lift that veil and pull it back and say, hey, you know what? It's okay to talk about this. If you've got, and I hear, there's situational depression, like if you go through a divorce, or if you lose a family member, or you lose a job, you can have a few days, weeks, or months where you're really down, but it's one of those things, it's not your chemistry. It's not your chemical makeup. So if you can explain the difference between the two of those, and then actually having clinical depression, to where unless you're on medication or have a certain type of therapy, you're going to be in that state and you need to get the help.
Yeah, and that's true, Kathy. We have to separate. The actual feeling is the same, no matter whether it's physically depressed or you had an event. Such as divorce,
right,
or death. Even those are helped or benefited by some conversation with a therapist. We have these people that are trained. Very few people can work on their car today. Very few. They get their car, a light comes on, and what do? They go get it repaired.
Right.
So you have this moment, but it's for some reason. You have this awkwardness. I just don't want you to think less of me. And so I don't want you to think that I'm sick or I'm ill, or wait a second, I can man up or I can woman up.
Right.
So what? I got rid of the guy. I'm glad we're not married anymore. Actually, you are sad.
Right.
Something just happened.
Right.
And it's time. We need to normalize these feelings. They're normal. And then we need to say, you know what? I think I'll get tune-up. I'll get a checkup from the neck up. That's all.
Right.
And yet we also know in some professions, though, especially, let's say, in the judicial system, attorneys are involved. We're looking for any advantage we can get in a case at all, and that includes picking on the other side, the other attorney, finding weaknesses. Up until now, if an attorney shows any sort of personal weakness, that is more often than not played on by the other side to gain an advantage in the case. Is there some way to be able to address that, to get the bar and the judiciary to open their eyes a little bit that drug addiction, depression, mental illnesses are all issues that need to be addressed and not exploited?
Well, you look at, and you use the term, look at it as a weakness. In fact, it's a strength. If you're going to be totally candid and honest, the most powerful thing you have is that integrity that says, look, right now I need help. And you have some advocates. Brian Cuban's a great advocate especially in the legal community. But we see a lot of the state boards around the country are having him come in to speak about mental illness and about depression and about substance use.
Right.
It's a solution. See, one of the things we talk about with substance use is we say, oh my gosh, this person's got an addiction. It's terrible. That addiction may be keeping that person alive. That may be their solution.
Explain that. So how does that work? I know we talk about co-occurring, or what is that term we use, where you've got an addiction issue. Patty, you talk about this a lot.
This is a really big subject in mental health issues,
right,
in that co-occurring illnesses.
That's it,
so
right.
It can be addiction, depression, anxiety, thoughts of suicide. Today is World Suicide Prevention Awareness. And so I was talking to Phil as we were getting ready to come in studio, asking about anorexia and suicide and the rate of suicide. So the co-occurring issues are very large.
And I think that's a huge topic. So when we come back from break, I want you to talk about that, because you're saying something that doesn't logically make sense. You're saying sometimes the addiction is keeping the person who's depressed or has anxiety alive. So we definitely want you to talk about that when we come back. And again, we're just so grateful to have our mental health moment here that we're bringing to you every Tuesday from 8:30 to 9 with Patty Gilot and with Stephen Dunn. And we're so excited to have you, Phil, in studio today, and appreciate you being here with us and being part of the crew. We're JP, Kathy, and the crew.
Hey.
Oh, hey, JP, you're
I'm
still
here.
there?
I'm waiting. Hey, Phil.
You sign us out.
Yeah.
Well, I will. And when we come back, I want to get to the meat and the bones of it. So I'm going to ask you a question. So we are JP, Kathy, and the crew. We come to you live Monday through Friday. Be right back.
On Facebook. So in any words of wisdom, but let's talk about the other when we get back.
Phil, it's so hard to get the word out to the moms and dads on the street about the things that we have discussed today. How can we better reach out to schools and parents and just get the word out more?
Hey, Kathy.
The resources
Yes,
that
ma'am.
we
Do you want to move her to that mic?
available, 'cause
Are you okay right there sharing the mic? Are y'all okay? Or yeah, you want to move her over there?
Yeah, we can.
Okay. So which one do I punch up now?
So
Two?
What are some of the things that we can do
There
to
you
better
go.
inform
Perfect.
the schools?
Yeah, bring the chair on over there, but then
So-
make sure you.
Or you
can
might have to use
see-
musical chairs.
I know that today,
Chair.
Grand Halliburton has an outstanding outreach, and they have folks that actually carry the message to the schools. It's recently that the schools have started to accept the fact that there are issues in the schools. I mean, it was not 10 years ago that if you went to a school and wanted to talk about substance abuse,
Oh, yeah. Yeah.
not in my school.
Yeah.
We don't have it.
We
in
don't
my
have
school.
that issue. Oh, I taught high school in the 90s, and there weren't eating disorders.
Yeah.
There wasn't drug abuse. Even though I went to the death of a young man who committed or died of heroin use
Yeah.
one time. I mean, it's just
That's good.
today's a different. With I think really the mass shootings and the school shootings have
Is this working?
made and yeah. Oh yeah, it's going to do a test real quick.
Yeah, is this working?
Perfect. Yay.
Excellent. Thanks, Kathy.
Excellent. You betcha. Well, it's Christy. Thank our girl
Thank
Christy. She rocks.
Appreciate it.
But it's one of those things. I think that you can't not talk about it.
If we don't, we're going to continue to see the results that we see today.
You're right. You're right.
Yeah, and that's why I was so pleased last month. Dr. Tyler Wooten from
Good morning
ERC
to the
and I
crew.
get
Yeah.
to talk to 45
Oh,
nurses
Dr. Dave.
employed in the Catholic schools
Yeah.
here in town, and they were we went past the time we were supposed to.
Yeah,
And
you
the
Ruth. I'm glad
questions
you
they
can
asked
hear.
and the material they asked us to supply them afterwards, I was just so thrilled about that. That's why I want to work with you to try to get that American tragedy documentary down here, because I think we could get a huge crowd.
Oh, not only, I told you that mother that spoke from Columbine,
Yes.
we need to get her back down here. She was here earlier in the year. I can't even imagine that, but we need to get her back down here
Oh,
to
get,
speak again.
and get her on the show, and we can load her up with school. JP and I can load her up with schools
Oh, yeah.
in Collin County that'll
1 minute.
And
hear
I-
her
I
absolutely.
didn't
Yeah.
do that because I spoke to the executive producer.
And
I
we've got
to
about
know-
50
in fact,
seconds.
She came down in October. We screened her going sane film.
Yep.
And when we were talking in April, she said, yeah, I can get the mom, because the mom is,
Yeah.
is prevalent in the film. So she was talking about not only would she come down, but the mom would come down as well. We could do a panel discussion afterwards, get them on the show again. We've got
tons of schools we could get you into.
Oh,
yeah,
yeah.
that would be
Yeah,
wonderful.
private, charter, and public schools we could get you into.
Yeah.
So-
I mean,
I reached out to Lisa this morning, would like to talk to you afterwards about.
I told you we've got a couple of people, I know a couple of organizations be happy to help sponsor that.
Oh,
So
that would be great.
Yeah, so we
You
can make
probably
that
need to
happen.
be here more than a day at the rate that we've got
10
opportunity.
Yeah,
10 seconds. Yeah, we have a whole week planned.
Good morning. Welcome back to 1160 AM KBDT News Talk Sports. We are JP, Kathy, and the crew, and we're proud to provide the mental health moment this morning with Phil Van Gilder, the Morgan Foundation, and Something for Kelly Foundation to provide you with up-to-date, state-of-the-art information in regards to mental health. We want to thank Acadia Healthcare's treatment placement team and behavioral health and addiction centers for being a part of this mental health moment and providing us with the support to be able to get the message out. Acadia's Healthcare Treatment Placement Specialists, known as TPS, are a free resource dedicated to supporting individuals in need of comprehensive mental health and addiction programming. All right, Philip, good morning. Welcome back.
good morning. Good morning, John.
Philip, let's get this down to the bones here. I'm a teacher, I'm a mother, I'm a father, I'm a son, I'm a cousin, I'm a daughter. And I've got friends that might be in need. I've got friends that might be in risk. What are some of the very basic things I can do as an individual to perform an assessment and be able to then connect that individual who may be in need to a healthcare professional? And who should I be looking towards to refer that person to?
Well, let me go back. If you don't know anything, if you're a mom and you're not sure where to go, we have this wonderful website that we worked on. It's the Grant Halliburton Foundation and the North Texas Society of Psychiatric Physicians created it a few years ago, and it's called herefortexas.com. And you can look in there and you can put in what you think your child is struggling with. And when you put that in, you say anxiety, I think my child, and then you can put in your zip code and it'll bring up 5 to 10 providers or 20 providers in your area. And it'll specifically show you who works with young people, someone your age, who takes your insurance. And that's the easiest way to do it. But even more importantly, is that intimate conversation you can have 8 to 5 days a week with trained professionals, and it doesn't cost anything. And that's even if you're not sure, rather than talk to your neighbor, which is not a bad idea, at least you're talking to someone, call that number, talk to a trained professional.
Well, and we're also, if you're kicking it old school on the dial or listening through Alexa or the TuneIn app, go to our Facebook Live page after, which you can share the show, and we encourage you to do so. And we're going to put that, the phone number's already on there. We're going to put the website on there as well. I want to get back to the question about how an addiction keeps a depressed person alive.
Okay, so someone's struggling,
Okay.
and they're struggling with anxiety, depression, or whatever, and they're going to take some action. But the action they take this time is to drink.
Okay.
They stay alive.
Okay.
It's not the recommended solution, but until it stops working, it's their solution. Why did I start to drink to begin with? Because I had this anxiety and I couldn't tell anybody about it, and I started drinking. And guess what? I became an alcoholic.
An alcoholic, yeah.
But you know something? I'm alive. Now, I stayed alive because what was I going to do if the depression got so bad that I couldn't handle it? Is I was going to take some action
Right.
to end the depression. Sometimes addiction solves the problem short term, but I'm just saying it keeps people alive. Why do we use Narcan over and over and over again? Because it keeps a heroin addict alive.
I mean, and that's, we've got so many, there's so many different ways we can go with this discussion. There's so many different avenues to take, but I think it's kind of like if you feel like you're having a heart attack, you're going to go to a doctor. If you feel depressed, if you feel suicidal, reach out to someone.
Yeah, even a family physician. If you can
Yes.
tell your local physician, I'm anxious. There's some things they can do, and almost every physician I know the first thing they would say is, let's get you talking to a mental health professional, and let me get you some anti-anxiety medicine. Not as a cure. See, we're
Right,
we're
right.
working with a symptom here, but I'm going to get you some kind of medication to bring you down. The other thing you can do is mindfulness. Let's breathe together. Let's learn how to breathe together. Put our feet on the ground and get grounded. Put our hand on our heart and get some oxytocin going.
Phil, in part, the 7 years you talked about for depression, does addiction, use of alcohol and drugs, does that partially explain why that 7 years it exists?
But actually, it exists because I'm afraid to tell anybody, and I think that I can solve the problem on my own with the same mind that got me here.
Very good. All right.
Well, thank you so much. We really appreciate you being in today. I wish we had 3 more hours we could spend with you on the air. And the thing is, reach out to someone. And especially today, you know, if you can post on your social media, share this, post something about how to get help, let others reach out so we don't lose another loved one to suicide.
Absolutely. Kathy, next week we
Yes.
have an outstanding doctor who's going to be calling in, Dr. Jasleen Chatwell from Sierra
Fantastic. So stay
So we're
tuned to
thrilled.
JP, Kathy, and the crew.
Philip, thank you.
Have a
Have a
blessed
blessed day. Facebook, there we go. Let's give that. I've put that out there, but let people know how to get out, who to talk to, if they're in trouble, or if they have somebody else who they think is in trouble.
Well, I mean, so not only you can always ask.
There's the camera. Talk
You can
to
always-
the audience.
yeah, You can always ask for a wellness check. That's the thing. Whenever I am suspect about someone's health and I can't get a hold of them to talk to them personally, I'm making a phone call to the local police. I'm going to get a wellness check. They're happy to do it. You can call 911 in any town and say, I need a wellness check on whomever, and they will do it, happily do it.
That's great news.
Right.
They would rather
Yes.
get there
Ahead of
before
time,
the
yeah.
issue
Proactive versus
proactively
reactive.
than reactively.
Yeah.
And that's a wonderful, that's just, and then someone else, the person that you're thinking about, will have a smile that you cared enough about them, even if
Yeah.
they're fine.
Right.
On for all you Facebook folks, well, we will have this entire interview up on the Mental Health Moment YouTube channel within a day. So it will be up. You can see Phil's smiling.
And will y'all
face the
share it
whole
on our
time.
radio show
Yes.
Facebook page? Perfect.
Absolutely.
Excellent. Yeah.
And whoever wants us to send a clip of this, by all means, we will. I'm sure, Phil, do you have a list, of
Good morning, Judge Kelly.
sources, or people want to contact you directly?
Yeah, they can call me. My phone number is 214-505-4553. Welcome to call me anytime. I take calls 24 hours a day.
Patty, do you have any last questions for Phil?
We are so grateful to have you here today and look forward to seeing
Yeah,
you
thank you so
more.
much.
And I know that your involvement with this documentary that is going to be coming to Dallas will be
Yeah.
very instrumental in the success in the next chapter. So please be there for us as well.
Thank you very much. Thank you
Thanks,
so
Phil.
much. You guys are great.
Thank you
Thank
so
you,
much.
Kathy.
We
Oh my
appreciate
gosh,
you.
it's so great.
Such a pleasure to meet you. Oh, I'm going to see if we can get Christy to get a picture of all 4 of us together.
Oh, that'd be great.
Let's see. Do you mind getting a picture, Christy? All right, and we'll say goodbye to Facebook. Mwah. Y'all, please share this this interview. Please. The life you save could be somebody you know. You just never know. All right, love y'all. Have a blessed day. We'll see you tomorrow.
We'd love to get Benita on sometime in October, November.
Oh, she's available.